Now let me tell you the combined use of antibiotics which will prolong the post-antibiotic effect. Now, even though every combination is unique, but general guidelines are like this, right? The general guidelines are, number one, two bacteriostatic agents, often they show the additive effect. Alright, the two bacteriostatic agents they will have the additive effect. Alright, now we have two groups of antibiotics depending upon how they suppress the organism. One we have bacteriostatic, the other one is bactericidal. Bacteriostatic, they don't kill the organism, they will suppress the growth of the organism. Whereas if you take the bactericidal agents are those antibiotics which will kill the microorganisms. Alright, now you take the two bactericidal agents are additive if the organism is sensitive to both bactericidal agents, right? Okay, so the two bactericidal agents, they are additive, right? So when do you think they are additive? If the organism is sensitive to both. Right, if the organism is sensitive to both. Now for example, isoniazid and rifampicin. Right, isoniazid and rifampicin in tuberculosis. Remember here both of them they are bactericidal, right? Both of them they are bactericidal agents. So two bactericidal agents are additive if the organism is sensitive to both bactericidal agents. Now let me tell you what will happen if there is combination of bactericidal and bacteriostatic. Now if you see here the third combination, right, the third combination of bactericidal with a bacteriostatic drug is additive if the organism has low sensitivity to the cidal drug. Alright, now let me tell you here combination of bacteriostatic with bactericidal. Right, combination of bacteriostatic with bactericidal, this particular combination is additive, right? This particular combination is additive if organism has if the organism has low sensitivity to cidal drug. Right, if the organism has low sensitivity to the cidal drug. Like for example, streptomycin plus tetracycline. Right, streptomycin plus tetracycline. Here if you see the bacteriostatic and bactericidal combination is additive for brucellosis. for brucellosis. Why? Because the organism is having low sensitivity for the cidal drug. That is the reason why this particular combination is additive. So the combination of bactericidal and bacteriostatic will be additive only if the organism is having low sensitivity to the cidal drug. Next you see the combination of combination of bacteriostatic and bactericidal. Combination of bacteriostatic agent with bactericidal agent. This particular combination is antagonistic. Alright, this particular combination is antagonistic if the organism has high sensitivity to the cidal drug. If organism is having high sensitivity to the cidal drug. Let me tell you an example here. You take penicillin plus the tetracycline. Penicillin plus tetracycline. If you take the tetracycline here, which is the bacteriostatic agent, and penicillin, it is a bactericidal agent. Now here the example is this combination for pneumococci. This combination is for pneumococci. Now in this combination, the penicillin, which is bactericidal, it is having high sensitivity to the pneumococci. That is the reason why this particular combination is antagonistic. If bactericidal is having high sensitivity, the combination is antagonistic. If the bactericidal is having low sensitivity, if the cidal drug is having low sensitivity to the organism, then this combination is additive. So this is what is your combined use of antibiotics. Two bacteriostatic agents are always additive. Two bactericidal agents are also additive if the organism is sensitive to both, that is isoniazid and as well as rifampicin. But remember, the combination of bactericidal with a bacteriostatic drug is additive if the organism has low sensitivity to the cidal drug. Example, streptomycin plus tetracycline for brucellosis. Next, the combination of bactericidal with bacteriostatic agent is antagonistic if the organism has high sensitivity to the cidal drug. Example, the penicillin plus tetracycline for pneumococci.